Hello, peeps. Welcome back to another episode of the Fly Shit and Scholarship podcast. I am your host. It's Dr. Meesh, also known as Dr. Timmesha Davis, and I'm here today with the lovely Dr. Jyla Hicks. How are you?
I'm so good. Thanks for having me on the podcast.
Thank you so much for doing this for me. I know it's a crazy season for everyone, so I really appreciate, and your crazy schedule, you being able to fit us in. So I really do appreciate it.
Happy to be here.
Yeah, so Dr. Hicks is another person that, again, I found sort of like scavenger hunting on the streets of Instagram. I do think though that somehow, some way, there's a connection somehow with a girl that I went to high school with that I can't quite pinpoint, but here we are. So Dr. Jyla Hicks is an internal medicine resident and a proud graduate of North Carolina Central University, an esteemed HBCU where she earned her BS in biology, graduating magna cum laude. She also holds a Master of Medical Science and MD from Boston University of Medicine. As the first in her family to attend college and pursue higher ed, Dr. Hicks is dedicated to mentoring underrepresented students in medicine. Recognized as a Howard Hughes Medical Institute scholar, a GlaxoSmithKline scholar during her undergrad years, and an AMA Physicians of Tomorrow nominee while in her final year of medical school. Dr. Hicks combines academic excellence with a personal mission to serve marginalized communities. Outside of medicine, she advocates for mental health and self-care, sharing her journal on social media to inspire others, and I absolutely love it. I also love the social media content, but we'll get to that at some point. But all of the great things, and congratulations on your journey along the way.
Thank you so much. I really appreciate it. It's been a
How,
truly.
yeah. How long have you been a resident?
I am halfway through my residency. So I've been a resident for about a year and a half. I have
Nice.
about a year and a half to go, and then that'll be it for residency, which I am looking forward to.
Nice. And where are you completing your residency currently?
I am in Boston, Massachusetts. I'm at Boston Medical Center and a few other hospitals that we also work at. So though that's my main one though.
Nice. And so where are you from? So I know that you went to Central, which one of my best friends went to Central, so she's gonna be geeked. But I know you went to Central, but and you're in Boston now. So where's your home base?
So my home base is in Columbus, Ohio. Grew up in Columbus, family still in Columbus. And then I went down to North Carolina at the amazing, illustrious North Carolina Central the Eagles. And then I came to Boston for my master's degree, medical school, now residency. So I feel like I've been a Bostonian for about 10 years now.
Fair. Do you like it?
I do like it. It's different, you know, going from down south or Columbus, these little cities to this big city. It's almost people relate it to like like a big city, not like New York, which it is.
Yeah.
I would say it is expensive. It's a cute little city. I definitely have been enjoying my time here.
I love it. I've traveled to Boston. I think I've been to Boston maybe twice, I think. And I like it. I mean, just like you said, right? Just it is city-ish, but I always feel like New York is cool, so not to knock New York, but I like cities that have a lot of things to offer, but that
Yeah.
aren't too overcrowded and too clustered. And that's what I feel like is nice about Boston is that it feels Boston and Chicago, I feel like have the very similar feel, right?
Yep. It's very. I have my half of my family. My dad's side of the family is from Chicago, so definitely like I. That is. You're definitely right about that comparison.
I love that. I love that. So let's talk more about what you do. So pretend to be very smart, but I'm every time I'm like looking at physicians and doctors, you see all different types. So what exactly does an internal medicine doctor do?
Sure. No, that's very fair. And I know people, even me, like before I got here, I'm like, okay, I have Grey's Anatomy and a few other shows that kind of relate to this. But
Yeah.
basically, internal medicine, it's a little of everything, which is really nice. And the reason why I did pick it, I know I want to focus on more so adults, which is
Mm,
why I did do peds, but like just adult and geriatric and care basically. You have a mixture or opportunity to do inpatient versus outpatient, which inpatient is basically you go to the ED, you're really sick, you get admitted to the floor. So that's kind of those doctors that's in the hospital taking care of you are internal medicine physicians usually. You could do outpatient, which is like primary care. You could do in your outpatient clinic like women's health, so taking care of pregnant women up to a point. There's like a wide breadth of like internal medicine physicians. You can go either way. You can do a fellowship, which I might be doing. There's so many opportunities, and the flexibility of it all is what I enjoy. I know I have some friends who are like procedure heavy and kind of like to be in an operating room setting. So they're going through internal medicine and then doing things like GI, where they're like doing scopes and things like, or sometimes I have the opportunity to do like lumbar punctures and put in lines and things like that. So it's procedure heavy if you want it to be. It's like more clinical heavy if you want. I just love having that flexibility. And then the knowledge that comes with internal medicine, from like a cut and you have to suture it, to someone is having like a massive like heart condition, they're in critical condition, they're intubated, like just that fund of knowledge and the variety I really love about internal medicine. So that's kind of why, and kind of a little bit of what I do.
Nice. So when exactly did you know you wanted to be a doctor?
Yeah, sure. So I will say too, I know some people are like, oh, I knew I wanted to be a doctor since I was two. Like that was totally not my journey. Like you mentioned before, I'm the first in my family to go to college. So I'm kind of like taking like, oh, do I like this? Do I not like this? Initially, I will say when I can remember being in second grade, like, oh, I want to be the first woman president, which is so ironic because we just had the election.
Yeah.
Quickly, I was like, okay, no. And then I'm like, well, maybe I do criminal justice and work for the government, which is what my undergraduate uh, studies was coming in as a freshman. And then
Mm.
I was like, oh, I really don't like this. And I then went to bioinformatics and I was coding for a while. And I'm like, I don't know if I could code for my entire life. And the interesting thing is, in high school, I didn't think I was good in science or like STEM. I just thought that wasn't my thing. And then I was exposed to a biology course. You know, you kind of have to do the standard courses in undergrad. I'm like, okay, wait a minute. I can do this and I'm kind of good at it and I enjoy it. And then, so from going from bioinformatics to biology, I walked into my like health services office just to see like chat. We're like a big family at HBCU, and I seen this pamphlet that talked about medical school. Picked it up. Long story short, that's how I was introduced to medicine. And then when I realized I like biology, I like the medical field, I'm gonna be a doctor. And it literally, I feel like I will always say like God really had my path laid out because everything fell into place perfectly. I had mentors and Black women who were biologists, scientists. I also had non-Black women too, or faculty that kind of helped me in my journey. And I have mentors that I did research with ultimately that I didn't go into their field, but they were kind enough to say, okay, I recognize this isn't what you want to do. Let me help you get to the next step. So I've had people kind of helping me out since undergrad and kind of showing me my way. And I ended up here in medical school.
I absolutely love that. And I love the journey because like you said, I feel like most of the times when you ask someone like, "Hey, what is it you want to do in life?" and then they say like, "Oh, I'm a doctor." And it's like, "Oh, I wanted to be a doctor for as long as I can remember." But I really do appreciate the context of the fact that you didn't start there. And also what you sort of hinted at was how traditionally we box kids, especially women, off from sort of like the math and the science and the STEM route. I think that we, over the past couple of years, we're doing a lot more to sort of incorporate little Black girls, little brown girls into the world of STEM. But the fact that you landed there is likely because the path just was not created for you to explore that. So it's like, oh, I take a science course and then I learned more about this, and I didn't even know that I was good at this, and I had no idea that I was going to be good at this until I tried it, which essentially means that it's all about the environments that we can create for people, right?
Absolutely.
So I
Absolutely. Agree. I 100% agree. And I think, and this is just, people know I love my HBCU down, but this is just going somewhere where I am cherished, where I'm the center. I have people who want to have like a personal investment in myself. I feel like if I would have went to a PWI or possibly any other institution, I don't know that I would have so many eyes on me saying like, "Oh, you're actually good at this. You can do this. Like, don't doubt yourself." So just having other people recognize, and like you said, being in an environment that supports Black people, who supports the youth, who supports like really working towards what you want to do and seeing something that I necessarily didn't see in myself. That's, I think that's really important. That's a good point that you do make.
Yeah, and let's actually explore the conversation about your HBCU. I mean, at this point, you've gone to Boston, you've sort of done the HBCU route. What has been sort of the most crucial thing for you in this crossover journey? Because I spoke to another doctor a couple of weeks ago about HBCU culture, right? And sort of like what HBCU culture offers us. And it's this sense of community and this protected environment and this safety, this idea that you can look around you and even if you don't do something well or you don't get something, you don't have to sort of guess the microaggression that's underlined, right? Like you can't say, well, it's because of my race or it's because of something else, because you know that you're in a protected environment. Whereas in other spaces, you almost sort of lend to that, right? This idea of the microaggressions and always having to wonder, is it because of something else? And I think HBCU culture has offered us the opportunity to just go and be protected. So you essentially going to Boston transition out of the HBCU environment. And so, what has that been like for you, or what was that like because you're no longer there?
Yeah, I think, going through, and what I didn't mention is I came through a program to medical school. It's called EMSSP, or Early Medical School Selection Program. So this is a program where my medical school recognized we don't have enough minorities, we don't have enough Black students here, and we want to support Black students becoming medical students. They specifically go to HBCUs and look for doctors to bring through this program and help with the extra support. So I will say, me being in medical school was definitely because I went to a HBCU. The other thing is, people, I will say, and I hate the debate of HBCU PWI, because I don't kind of get into that. But what I will say is my HBCU set me up to maneuver these situations, maneuver being the minority in medical school, being one of the 10 maybe Black individuals that are in medicine, who are in the hospital, whatever you might say. And it's interesting because people are like, I don't want to go to a HBCU because then, like, I don't know what real life is. Listen, this was the one time in my life where I just felt free, able to be me, like you said, able to not having to look at the microaggressions or second guess anything like that. I had professors who looked like me, who I knew I could do exactly what they could do. PhD
Yeah.
scientists, like the head of the president of the school being a Black person, being in that environment, it just gave me so much confidence, and it just poured into me so much. When I left, you couldn't tell me nothing. Like, I felt literally ready to take over the world, and I feel like
Yeah.
that's because my HBCU prepared me for that and prepared me for what was coming. I will say, coming to Boston from North Carolina, that's definitely a culture shock. And then, just like I said, being the minority in medical school, having very like intense racial interactions, where after I left those interactions with my peers and my fellow medical students, I went to my room and cried and had to debrief with my best friend, who was also Black and from an HBCU, because we're experiencing these things. But I felt like I was equipped to handle that because
Mm.
environment and where I came from, and how so many people poured into me, and how I was built up to say, you're smart, you're capable of doing this, you have this knowledge, go out there and do this. So I think just having that support and having that foundation set me up for the rest of my life, 100%.
That's amazing. And I also agree about the argument of HBCUs versus PWIs, right? Because, my journey sort of was similar but different, right? So I went to University of Maryland for undergrad. I went to Howard for my master's program, and then sort of like back to Catholic for my PhD. And that was a decision that I made solely out of convenience, right? Like I needed to work, I needed to work, and I didn't have the luxury of some of the other PhD students who could just, go to class during the day and do what they need to do and just sort of focus on school. Like that just wasn't my story. So Howard was not an option for me for that reason, because they did classes during the day and they really wanted your life to be Howard. And I couldn't sort of sustain that. But I agree that I'm an HBCU advocate 100%. I also think that there are ways in which my HBCU experience at the time that it did was the foundation for the work that I do, right? So I started my master's program at the University of Maryland in Baltimore, and I was there for a semester and I was doing fine, but I was like, this is not going to work for me, right? Like the people that I want to work for, the work that I want to do, it needs to sort of be centered around culture. And so I was like, let me just go over here where I know I'm going to get it, because they teach sort of from this perspective. It's called the Black perspective in social work. And I agree that it created a foundation for me. And so even when I got to my PWI for Catholic for my PhD, there were times where I was constantly second guessing. And my mentor at the time, who is a professor at Catholic, she was amazing, the only Black woman. I called her one day and I'm like frustrated because it's during my dissertation period. And I'm like, I just feel like this is happening to me because I'm Black. And she was like, could be, right? Possibly. And I wouldn't doubt it, right? I'm like hoping, she's going to say, no, not at all, because she's been there for forever. She was like, could be. And she said to me, she said, but the purpose of racism is to keep us down. The purpose of racism is to create a system and a structure that doesn't allow us the opportunities as other people. So, yes, this may be something that you're experiencing, but if you dwell on it and if you sit in it, it's going to do the exact thing it was designed to do, which is to
Mhm.
put you in a place where you don't make movements, right? And so it's that sort of like thinking that comes from other Black people, like you said, who you can look at and they've gotten the things that you want, and they can sort of pull you in to validate you, right? So she did both. She validated my experience at the time to say, yes, indeed, this is likely what's happening to you. But she also gave me a very practical sort of strategy to deal with it. So I don't just say, oh, I'm experiencing racism and let me sit in it, because it really was a barrier to my progress.
Yeah, absolutely. And that just speaks to everything you said, speaks to representation and why we need Black women, Black individuals, Black men in positions where we want to see ourselves. Like, I couldn't imagine not having someone to go to that looks like me and has been through the same journeys, the same trials and tribulations as me. They're able to speak firsthand and kind of hold our hand, which is sometimes needed through these situations, because these are real life situations. And yes, somebody else can give you advice and tell you what you should do, but if they haven't been through what you're going through, then it's kind of like, okay, thank you, but now how am I really going to apply this? Like, what's the repercussions possibly really going to look like?
100%. 100%. So you've had your experience, right? And now you're here, right? You're in your residency. You're sort of like working through the weaves. And as we established in your bio, one of your major things, and some of the stuff that you sort of discuss on Instagram too, is this idea of being in internal medicine and sort of giving back to the communities in which you've come from. So, what are some of the major things that you've found you've needed to address, sort of like health disparities, et cetera, that exist particularly in your targeted demographic?
Sure, sure. So, I mean, health disparities, we know, like some of the most health disparities encountered by Black people, Black and brown communities, high rates of diabetes, hypertension, we know, which is, I'm glad it's getting so much attention, poor maternal health outcomes. And then just overall limited access to quality health care, whether it's due to location, systemic racism, like we said, or just social and economic status. And what was important to me, I knew I was not no longer in a HBCU setting, but giving back to a community who looks like me. I am one of the largest health net safety net hospitals in New England. So 57% of our patients come from minority communities. About 30% of our patients don't even speak English. I'm interacting with people who are coming straight from a flight with luggage in hand to come get care at my health center, which is why I picked this location. That just speaks to the commitment of my hospital. And in my practice, one thing you really have to do is look at a person as a whole. Often medical concerns, we're talking about diabetes, hypertension, they're not the first thing that's on their minds. Things like mental health, things like food insecurity, access to social services take precedence. You can't like fix the diabetes or the high blood pressure until you're getting to the root reason why. So addressing these underlying challenges is really critical to improving overall health outcomes. Basically, I try to give provide culturally competent care and connect patients with resources that we have, whether that's going to our food bank, getting help with taxes, child care. I take the person as a whole individual because I know there's so many other factors that impact glucose or impact heart disease, and not just someone not taking their medicine. Bottom line is I try to look at the person as a whole, acknowledge where they're coming from, acknowledge what barriers they might run into, and assist any way I can, and then also provide the healthcare support and apply.
What you've essentially just described is this idea of cultural awareness, right? Which is something that, any helping profession that you are in, they always sort of speak this idea of, you know, culture humility, cultural competency, right? And some of it can be learned, right? Like some of that can be learned via training, but I think because you are who you are and sort of your dedication and your own experiences, you're establishing that it's not just the person and what they're showing up with, right? So, yeah, people are showing up with these health disparities, the diabetes, the hypertension, and all of these things. And what you're saying is, okay, yes, a part of this could have been related to a behavior or an action or a pattern, but a lot of these things that we're sort of seeing is related to environmental context and environmental effects. And so, as a physician, right, as a doctor, when you are sort of encountering these people, it's not just, oh, you didn't take your meds and you have hypertension because you chose to eat bad, or you have diabetes because you chose to eat bad. It's like, okay, if we truly want to address this, yes, I can prescribe all of the medicines in the world for you, but it's not just about that, right? It's about some of the environmental context. And I really like hearing that you're taking that approach and seeing people as a whole person, because that's something, again, that's familiar to me in the world of like social work and like whole
Right.
person and environment perspective. That's our jam. But I like that this is sort of crossed over to the way that you practice. Is that something that you are used to doing because you are who you are, right? So you are a woman of color, you are showing up in this place, right? You have family members of color. So, or do you feel like some of that was taught to you along the
Yeah.
way?
Yeah. I think like you said, innately it's just in us. We are our patients
Mm-hmm.
essentially. And our family members are our patients. But it's also been taught. There's always something to learn. As a Black African American woman, I cannot necessarily relate to maybe like a Haitian individual and their culture. So this has took studying. For example, if someone's coming in with diabetes, me recommending a generic like diet plan, I need to research their cultural food preferences, work with them to find healthy alternatives. I have the knowledge because I'm a Black woman of knowing this won't work. But then you have to take it a step forward and say, what's their culture? How can I make this health plan adapt to them? I think it's great that now, especially in healthcare, these last few years that I've been coming up, providing culturally sensitive care. Now other individuals are aware, like, okay, we can do XYZ, like you said, do the medicine, do the visits, but until we take care of that whole person, it's things just aren't going to fall into place. So I think combination of me being my patient and
Mm.
knowing barriers are coming. For example, we're recommending people to work out, especially not especially black women, but we're recommending people to work out 3 to 4 times a day. As a black woman who has a fresh silk press, I to the gym this week. You know what I'm saying? So just recognizing that there's other things that play a role in everyday life, and everyday life is going to continue to happen. How can we adapt around that? And how can I tailor healthcare to that person? Because one thing is, like, I look at healthcare as a serving role. Like, I'm
Mm.
here you. That is, I think it's such an honor, such a privilege to be invited into someone's the most intimate part of their lives. And that's when they're sick, when they're vulnerable, where they're at their doctor. So I'm here to serve you. Let me come into your world, come into your culture, your community, and let's figure out how to make things work together. So I think some people, it can be taught, but some things you just have, and that's one of the pluses that come with having a physician from your culture or someone who looks like you, somebody can understand those things.
Yeah. How do you fit that in? Because I'm thinking about the world of health insurance and how it works, right? And I am not going to get this 100% correct, right? I'm just going to go some off of my experience and some of what I know about insurance and billing, right? And so many people have sort of this misconception that my insurance is paying my doctor a hell of a lot of money, right? And this context may be a little different if you're sort of working in the ER. You've seen ER bills that come and they're massive, right? But most of the times it's all of the nuance thing. And so the anesthesia you got to pay for, or the IV that you have to pay for at the doctor's time. But most of what we know, right, about the way that insurance pays providers is by the time, right? So I am paying you for a certain block of your time, which is why if you go to sort of your day to day physician appointment for your yearly checkup, the doctor's in there a certain amount of time, unless you have doctors that sort of carve out and still spend a decent amount of time, right? It's always a surprise to people when they say, "Oh, my doctor was in here for an hour and they asked me all of these questions," because that's not normal. So, how in the hell are you able to fit this in, right? What you're talking about. So, thinking about somebody's health plan that's conducive to them, thinking about all of the barriers that they're facing, and sort of creating a treatment plan that is going to be effective. But how in the world do you find time to do that in such a very small section of time that's allotted to you for each patient?
Right. As you hit that nail on the head, healthcare, it's such, things are just like such a time crunch. And I think the thing that I love about internal medicine is continuity. So I'm not just seeing you one time, I'm
Mm.
seeing you multiple times, sometimes every month if you need to. I will say things like for the health insurance and billing issues, because I'm a resident, I'm still protected in that I do get a little bit more time. And then I work for my clinic is actually in a government setting, so I have a little bit more leeway. But it's really just in general, does your provider kind of, and some people cannot, and I don't know how realistic it will be in my practice moving forward. I will make sure wherever I choose to work is conducive a little bit for me to provide this care. But it's a lot of outside work that people don't see, a lot of pre-charting and into XYZ, that things that aren't billable, but because you are a healthcare provider, these things are important, you're still going to do them. So not everything is billable. So it's a lot of background work on my end, but because it's something I enjoy and because I am invested in seeing my patients kind of do their best, this is something I put the work into. But I really think it's unfortunate, but it's sometimes there's just not enough time. You have minutes to do a visit, and then you have to go see someone else, and you might come in with a list of 10 things that has happened to me, and I have to say, okay, let's prioritize the two things that are really important to you. Let's tackle that here. Let's see you very soon to get those other issues. So, I mean, it's very hard. I can remember being on a patient before I was even in medicine. I'm like, I'm only seeing my doctor for like 10 minutes. I'm with the nurse, I'm waiting. But being on the other end of it, it's really hard. Some doctors see up to 20, 30 patients a day. And it's just that it's such a unfortunate thing, but it's just you have to find ways around it without burning out, because that's important too. So providing the care that your patients deserve, but also allowing yourself the time to decompress and kind of have that work life balance is important. But it's definitely hard, and I am very like empath, like I feel that 100% as a patient, as a doctor.
Thank you so much for that context, because it is very easy for us to get caught in our own experiences of something, right? And so I've only ever been a patient in that context, right? I have private practice, but I don't accept insurance. I'm self pay. So I can sort of do what I need to do and do what I want to do without the constraints of that. But I also recognize that being self pay is exclusionary in a sense, right? And sort of the people who probably really can benefit from the services but can't afford the out of pocket. But I appreciate you basically giving us the perspective from your side, which is sometimes it's 20, 30 people in a day, and you have to have that many scrunched into the day in order to get and meet a salary of some sort, right? Which is the other piece about how insurance works. And so I've only been the patient who is sitting and complaining, and I'm just like, okay, you didn't get all that you were supposed to get out of me, and you asked me this amount of questions. But
Right.
from your perspective, what I hear is sometimes it's coming from a place of, I know that you're here for X, Y, and Z, but I'm also under the constraints of what I'm under, and sort of like, how can we prioritize this? And the fact that if you wanted to go above and beyond, that's a service that's not billable.
Right.
So it's really hard work. So if you come across a doctor who is going above and beyond, the acknowledgement is, oh wow, like you aren't even getting paid for this,
Yeah.
which is
Yeah.
crazy.
It's a lot. And the thing is, which I really love and appreciate, things like my chart and being able to message your provider. Some like there it's just so it's great that we have such access to our providers now. But being on the other side, I have a patient, I have patients to call back. Like I have a patient that's really sick that needs to go to the ER, but it's just so much to balance. And I really hope moving forward with insurance and think like salaries, like you said, it gets better, because it's just a broken system in that sense. It's hard to get anything done in 20 minutes. But like you said, finding a provider that kind of, okay, I'm here for 20 minutes. What's important to you? Let me address that and make sure you're getting what you prioritize out of this visit. And me not just say, oh, let's checklist your blood pressure, your weight, your blood sugars, and let's get you out. So it's kind of finding that balance where this is important to me. I understand this is important to you. Let's optimize our time together and try to make the best out of a unfortunate situation.
Yeah. So I just heard you talk about my chart, and I just got so excited because I'm like, I love that thing now, to just be able to text or email and be like, "Hey, can you answer this question for me?" But I never. So wait, because now I'm like intrigued. So is that something that's considered billable for you guys on your end? Like, how does that work? Because I
Right.
do see it as, oh, it's great that I have more access, but I never thought about what that may be like for the people on the opposite end.
Sure. I will say, for all transparency's sake, I cannot speak to the billableness of it just
Fair.
because I'm still in like a resident position. I think there is, and I might be misspeaking, but there's protected time. But when you have 1,000 messages of people asking you questions, you have 1,000 lab results coming in that you need to then communicate with others. I don't know that it'll be able to be billable every single time. So it's just so hard. I'm not really sure, so I can't speak on that. But
Fair.
will I say is there's a lot of outside work that goes on that I know for sure is not being compensated for. But it's okay. Like this comes with being in a clinic, primary care clinic, being a physician or anything. But my chart is a great feature that I do love because it gives people who maybe have transportation issues or any other barriers to get with either their doctor, a nurse, somebody to address their concerns. Any kind of like connection. I was just speaking to somebody about this. Any like the more interactions that someone sees with healthcare, I feel like is better. So they're just not lost. Like if I'm running low on this medication, it's not refilled, and you're reaching out, that's a great thing because that means that lets me know you're taking your medication. Or if you're concerned about XYZ, I love that because that means that you are invested in your health and you're worried about something. So let me take the time to acknowledge that. But I think going somewhere that has a good support staff who has people there available to answer your questions, I think that's always good.
Yeah.
I don't want to deter anybody. Like, let me not bug my doctor about it. But sometimes I'm looking at my inbox like, okay, let me come back to this.
Yeah. But you know what? I don't think, and maybe you do realize this about how you are preferencing your language and the language that you're choosing to use. I think it consistently goes back to levels of empathy and being sensitive and culturally sensitive. And when I say culture, I don't mean just black or white, right? I'm also thinking about people with disabilities and disorders that you're sort of having, chronic illnesses that you're having to come across. And so the fact that your brain has framed it in the sense of, if you're messaging me, you care. If you're messaging me, then you're connected to whatever it is that you're experiencing and you are trying to do your best. If you're messaging me about meds, that means that you are paying attention to them, right? And the beauty of that is that you are being patient forward and centered and not sort of taking it from the standpoint of you're being a nuisance or annoying, because that's how I feel. I ask 50 million questions, right? Anybody who knows me knows that I ask 50 million questions, and I can imagine for other people too. So to hear you say and take that standpoint, I think can be helpful for other physicians as well and other doctors as well, to say, like, if people are messaging you, even if it's 50, 60 messages across the lifespan, it's because they care about themselves. And so how can we use that investment and that energy about how much they care for themselves into their treatment, into their intervention plans to make it work for them? And so I just enjoy hearing you come from the standpoint of, this is a person who's being inquisitive rather than this is a person who is being annoying.
Yeah, and I think, like you said, it's all about kind of this leads to like there's so many physicians. All physicians are smart to some degree. So it's when you're looking for a healthcare provider, physicians, PA, MP, whatever you're doing, you really have to look and see, okay, when this physician is burnt out, when they're sick of it, how are they still going to treat me? Because I feel like, and I hope, I pray that I carry this attitude with me, and I'm so happy that you are able to recognize. But like I said, I feel like it's an honor to serve people, and even on I've had a lot of days where I've been down bad, sick, crying, throwing up, but I still show up for work and I still show up for my patients. And I think that's just a testament of how much I do feel like, wow, I have this opportunity. Let me take advantage of it. I think it's people don't realize how vulnerable patients have to be, and some people, and I will say, like, I work with a variety of patients, like you said, not just black or white, or persons with who live with disabilities, or persons who have substance use, which I hold near and dear to my heart. These are people who are having challenges every day, and sometimes people get labels of, oh, they're difficult, or they just. I've been in a handful, unfortunately, of situations where, oh, this patient, like, they're not going to take their medicine, like they're going to leave and go XYZ, and I just go in and have a conversation, and now they're happy to be engaged. It just takes meeting somebody where they're at, asking questions. Why don't you want to get this test? Oh, it's because actually they're claustrophobic and they're scared of XYZ. We can give you medicine for that. You can get this test that you really need, and we can move forward. But you just need somebody to be able to go that extra route to say, okay, what are the barriers that's stopping this person from doing it? Because there are some people that's like, I don't want anything, and that's fine too. But a lot of times there are reasons for the hesitancy, and they're not just being a difficult patient or being like resistant to care. So you just have to, and for other healthcare providers, and I know I'm a young physician, but like just taking the step back and saying, okay, if I was this person, what's making them hesitant or XYZ? And like you said, just being sensitive. When someone is coming into interactions with a doctor in the healthcare setting, whatever, most times it's because they're sick or something's going on. You really have to just take a humanistic approach to healthcare, I believe, to really be able to provide good care.
Yeah, such a great thought too of going into it and how you approach it. And the word that you used is vulnerability, right? Historically speaking, our community of people has not been trusting of the medical system, and rightfully so, right? We are not gonna get into the details of that today, but historically we have not trusted the medical system. And so I think it's an important thing to know that you are asking people who are already, their baseline is already low because they're struggling with something that they're trying to figure out that they cannot figure out themselves. Because if they could, they would, right? And we've come from sort of the historical background of needing to figure things out for ourselves due to disparities within the healthcare system, due to lack of insurance, due to lack of trust and vulnerability, and lack of competent health providers. So you are saying, okay, if I already know that this is a community or this is a person who at baseline does not trust me, does not trust, like, even though they know that they're here to get some advice and sort of like some support from me, I know that it took a lot for them to sort of even walk through the door. Because in order to receive something from you, I have to trust and to be vulnerable enough to say, there is a possibility, right, that you're going to tell me to do something that may or may not work or that could make this worse. And so, how can we on the other side, as in you and other doctors, right, sort of take the approach to say, if somebody's already coming in here and they're vulnerable, how can I ensure that I am creating an environment for them to trust the work that I'm doing? And a big part of that is rapport building. A big part of that is building relationships. It's actually caring about people when they come across the door, not just sort of your
Exactly.
ultimate goal, but just
Right.
care, right? And patience, and sort of walking through the idea that you are seeking help, and I am honored to be able to provide you with something that you cannot give yourself.
Right. I think that you are spot on. I think that's so important. And like you said, especially in healthcare, the historical trauma, the systemic racism, like that's very much real. And what kind of grinds my gears, or I say, you have to name this stuff. Like it's like a cloud that everybody sometimes like tiptoe around it. Like you know what's going on. You know why certain situations happen. The impact of like historical trauma and systemic racism on the health of Black and Brown patients is very much real. And my thing is, you just have to name it. Name the racism. Name the trauma. No, acknowledge that these things are real and that your patient are like suffering from these things, and then kind of approach it head on, because that's the only way to begin to unpack these things and to build that relationship, like you said, and for your patient and yourself to be vulnerable. You can't, it's a disservice to patients to kind of like tiptoe around the issue that we know very much impacts them. So I think that you just have to name it, approach it head on, and move forward with it. And I feel like patients will really appreciate that, instead of kind of trying to be politically correct or like allude to it but not say it. Maybe we know what's going on. Like I went to medical school in the George Floyd era. People were having protests, and kudos to my school, but everybody want to have workshops and kind of cultural competency, and we're doing this, and we had a whole workshop, and it was a situation where it was like blatantly this person was treated this way because they were Black. And you would have, I had peers saying, oh, maybe because she's a woman, or because they have on like a red shirt instead of a green shirt. and the preceptor was going along with it. No, it's because they are black. Like, let you have to name it, because we all in here playing, looking at each other. I remember my best friends who are also black. We in there like, uh, like, you have racism exists, prejudice exists. They often directly affect health outcomes. Making it a point to acknowledge it, or we all in here playing like, looking at each other. And I think it's such a disservice. You have to, if you don't feel confident in doing that, I feel like as a healthcare provider, it's your job to make sure you are comfortable providing that, or comfortable acknowledging that, so you can move forward and provide care, because it's not just about treating the illness, it's
Yeah.
about addressing the context in what that illness exists, in which that illness exists. So that's just my soapbox on that issue. But I'm just like, you cannot ignore racism. Like, you just can't anymore. It's really, now you're literally playing in my face.
Yeah, yeah. And a part of the problem, at least that I've found, right? So a part of the problem is no one wants to be labeled racist, right? So there's all of this sort of work around and go around, because when you bring up the word, it's like everybody gets real quiet and silent, and very similar to when we bring up just the word white, right? And the labels of like what it means to be white and the ideas of white privilege. And so I think because of how difficult it's been for people to just get past the word, we're not
Mhm.
having the conversations that we need to have. And so, like you're saying, this is real, right? Racism in healthcare, disparities in healthcare, disproportionalities, historical trauma, all of these things are real. And if we can't even be comfortable with saying that out loud, then how are we possibly going to be able to address them? It's impossible, right? And it will be impossible to do so. And you are right that we have to sort of like push the needle forward. And I tell social workers all the time, this idea that you don't see race and you don't see color and all of this, like, throw that out of the window, because
Please.
that is a false sense of reality. Because when you say things like that, you are invalidating the experiences of the people who have been on the receiving end of disparities and racism and segregation because of their color. So you have to see color, right?
You have
And
to.
you have to see your own. So
Yeah.
acknowledge what it means to be white. And I know that we are in an era right now where DEI and all of those things are being dismantled every single second, every moment that we blink. But the reality of it is you first have to acknowledge who you are. And I say this even outside of culture, right? Like, I can speak from a person, I do a lot of like disability forward research and work, and even starting from that, right? I first have to acknowledge that I am a person who identifies as being an ableist person, right? Like, I am able, I can use my bodily functions. And so I first have to understand what that means for me before I can understand what it means for another person who can't. So if I am a doctor and I'm encountering something that I've never experienced before, or a person I've never experienced before, whether it's a person of color, whether it's a person with substance use disorder, first I got to understand who I am in order
Yeah.
to provide the best service possible. And so it's really just a lot of self reflection that I don't think people are willing to do half the time.
Yeah. No, yeah. That, for dead ass, as I would say, like, no, for real. That's you. It like that takes a part of, like you said, you have to be real with yourself. Like, you have to uncover kind of layers that maybe you have never like reached before. You have to realize, why do I feel this way, or why do I react this way? Why does my body feel like this when I hear this word? You really have to do the work to be not only a better person, but be a better person for your patients, or whoever you're serving.
Mm-hmm.
Because not, again, we're just playing, like, we're literally being very surface level, and you're not going to be able to have those connections and everything else with the individuals that you're caring for.
Absolutely. And the connection piece is important in
Yeah.
anything that you do, because I'm going to consistently go back to the vulnerability and the trust. If I don't
Yeah.
trust you, every step of the way, I'm going to question your motive. I'm going to question what you do. I'm going to question the way that you're talking to me, the way that you are engaging with me. There has been times where I've been in the space with a doctor who wasn't black, right? But I could trust them and I could be vulnerable with them. And so even if they threw out a joke or two, I knew that it wasn't coming from a place of malintent because we built the relationships to sort of walk through and for me to feel comfortable with you being your version and your best version of yourself. And so knowing yourself and sort of figuring out all that you are, like you said, why do I feel this way when I hear this word, or why do I approach things a certain way? And we all have personal biases, right? Black, brown, white, abled, disabled, right? LGBTQ plus, everybody has a bias. And you have to understand what yours are before you encounter and go in and work with people, especially in helping professions. And so I love that you've sort of like taken this journey. And so where does it sort of take you next? So you're halfway through residency. Like, what is the ideal world for you?
I mean, the ideal world for me would be traveling, waking up at 11 a.m., going in the clinic, maybe seeing one or two patients. But in a realistic world, I think life for me looks like kind of really, I feel like my purpose is serving systemically marginalized communities.
Mm,
I have realized that going through coming from where I came from. I have a lot of family members that are suffer from substance use disorder. My sister is a part of the LBGT community. She is trans. So, and I'm also a Black woman. So I have family members who have been incarcerated too. So I have so many dynamic things that make up myself that I have now put forward into my healthcare and what I want to do. Currently, I am involved with the Medical Justice Alliance. So I actually work with lawyers and paralegals and things like that, advocating for persons who are incarcerated to get early passionate release, or just advocating that they get better care where they are. So that's something that I have taken on that I really enjoy, that I'm doing during residency, that I hope to continue to do. I am also very passionate about about people who suffer from substance use disorders and that type of care. And I would love to go on to fellowship to be able to work with this community more in depth. But I just feel like that's another marginalized population that a lot of people don't think about, but that just get written off. And it comes with people who are unhoused, who again have other disabilities seen and not seen, that I just love working with. So I really commit my time to projects and my clinic time to serving those well. I will say my ideal of life will lead to me working and continuing to serve these populations. It would just be such an honor just to do that for the rest of my life, because it's something that makes up me, and then it's something I really care about. So that's what my life looks like. Probably working with minority communities, continue to be a mentor and help others, especially Black young girls, come up, and hopefully through medicine. I have a lot of peers that I work with, and like sometimes people that I tutor just to help get them to the next step. I will absolutely love to continue to. That really just brings me joy. These are all things that kind of fuels my passion and really makes me like pours into myself when I'm working such like a demanding field like medicine. So those are kind of the things that are on the horizon, and then just doing things that I enjoy. Like I said, traveling, spending time with friends, things like that.
yeah, that's so beautiful. And I am a firm believer that a lot of the times we land in these positions and somehow, some way, we always connect the work back to our sort of lives in a way and experiences in a way. And I think that that's what truly makes people, especially people of color in the helping professions, I think that's what makes us so beautiful, right? This sense of I'm doing this because I'm passionate, because I'm smart enough to do it, but there's always a big piece of it that's connected to something that feels familiar to us, and I think that typically drives the passion a lot more. And it's the same sort of thing that I experienced too. A lot of sort of my connection to individuals with disabilities and kids and with disabilities in the school to prison pipeline is from my own experience, right? Like not mine, but someone that people that I love and that I've been connected to in my family and in friends. And so I truly enjoy the fact that you sort of are making progress being the only doctor in your family, being the only person to graduate in your family, and is circling it back around to sort of pouring back into your community is so good. And I'm going to ask you sort of like an offshooted question, which is you have not said much about your why and your connection to that, but do you ever experience sort of like survivor's guilt and remorse, right? So being the only person from your family to graduate from college, sort of going being the only doctor in your family and sort of living this life in residency and what it means to be a doctor, and likely having sort of other experiences or people that you're connected to that haven't sort of gotten here. Have you ever experienced survivor's guilt or remorse because of your sort of pathway?
Yeah, I think not so much. There is definitely a level of guilt, but it's more so, okay, so I have these feelings. What do I do with this? Like, I now, it's generations, the next generations behind me. I have like a little cousin who just graduated from Ohio State and getting her master's in social work. So, me being the first, leading the path to make sure everybody who follows and giving those guilt, because it does feel guilty, like, oh, I have done 10 times as more. Now I'm bringing everybody with me. So
Mm,
now we all about to eat. So now if I do, I have persons who suffer from substance abuse, all that. That might look like me opening up a clinic. Now everybody about to work in here in a clinic. We're all coming.
right.
It's a family thing. Like, so me having to recognize, okay, I have a privilege that my other family members do not have. And I am so blessed and lucky that my family supports me. They keep certain things from away from me that know that might impact me, impact my journey. They have supported me thus far. Now we all have to come. Now I can take where I'm at, the opportunities I have, I can share them with my family, with my friends, and we can all continue to elevate. And I think that's kind of where the whole generational wealth and all that, but it's real. It only takes one, and kind of changes the pipeway and the pathway for everybody else coming after me. And then even those before me, we're all going to be better because of me. And that's what I am, a resource to my community. Like when I go home, I go back to church, or I try to go back to church. I haven't been able to. If my pastor watching, I'll be there. But I try to go back to church, give back where I can. Family members know, like if they have a medical, they hate asking me medical question. I'm like, this is what I'm here for.
Yes.
This is what I am here for. It would be, what am I here for if I'm not going to be of service to you? So not only your patients, but everybody's coming with me. Like this is a family affair. My last name is Hicks. We are all Hicks. We're all doctors at this point. And that's the attitude I take because everybody's coming with me.
Yeah.
Um, yeah, there is that feeling of this is a little uncomfortable, but what am I going to do to fix that? And
Yes.
that's where we are right now.
Yeah. And I'm so happy to hear that that's the way that you're processing it because that's what I heard and that's why I asked, right? So when I hear you saying like I'm dedicated to this particular demographic and this particular population because I want so much more and I want to be a tool and a resource, I wanted to sort of pick your brain about that because I think that that is the way that you're able to resolve the small sense of discomfort that may come up, which is okay, yeah, I might be uncomfortable, but like you said, what am I doing with it? Right? Like,
Yeah,
am I doing something with this sense of discomfort? Am I going to circle back around? Am I going to pour back into it? Because the only way that I can sort of validate the remorse or the guilt is if I do nothing, right? If I sort of just go on about and live my life and say, you guys figure it out, then that's when it becomes bad. But I love to hear, like, at this point, we're all, and that's how I rock with my cousins too, right? My cousins, my aunties, they're
yeah,
always in the comments. I love them bad for it because
yeah.
they are typically rooting for me harder than I root for myself.
No, and that it there, I will say there was a time, and this is just me being vulnerable, a time in medical school where I was like, I don't know if I could do this anymore. Like just mental health wise, I was just so done. And I was like, I think I'm done. And then that's my family. My grandma is at church praying for me. My mom and my sister and my friends just pouring into me like, no, just do it one more year and just keep going. And it was me having to mentally get better to understand, oh, I can do this. But to have my community say, girl, you got this. Like, it's going to be hard now, but it's not going to be hard forever. Keep going. I wouldn't be here without my family or friends. So it's only right that we all about to be on the yacht whenever that comes. We all ready.
You sound like me. I'm always talking about somebody's yacht and coasting
Listen,
through the Amalfi Coast. That is like in my head, my biggest dream. I'm gonna be going on somebody's yacht. But
it's
same,
specific.
like I
Yeah.
remember stepping off the stage at my master's graduation, and my aunt and my cousin was there, and they were the first person I seen when I came off the stage. And she was like, "Okay, and next up is like your PhD, right?" And they had known that I wanted to do it many years ago, but I was so burnt out. I was like, "Absolutely not. Fuck that. I am done." Like like Howard tore me to shreds, and not
Yeah.
because of the typical drama you see about Howard. So don't y'all play with my HBCU now, but just
Period.
because of how vigorous it was and how
Yeah.
hard it was, right? It was the very first time I had been in a place where I've done work at this level and I get back a C and I'm like, a C? Well, who that for? Like,
Yeah.
you know what I
Yeah.
mean? Like, and so there was a period of time where I was like, I can't and I don't want to and I am beat and I am done and I'm tired of like stressing and struggling. And at that point, I had been in school for, I mean, what, 12 plus 4
Your
plus
whole
2?
life. Yeah.
Forever. So I'm like, nah, I'm good. But like you said, it's the drive of my mother and my aunties and my cousins who are just like, yes, like, and super proud of me, right? Like, oh, my cousin is doing this and my cousin's gonna be a doctor, and I'm like, you know what, you're right, you're right. So I do completely resonate with that and the dream, and so that
Yeah.
sort of kind of connects me. How are you doing it all? Because you be lit on the gram, you be looking amazing. I be like, yes, like the outfit, the hair is always on fleek. How in the world are you finding time in the thick of residency to still be a baddie?
If you could have seen me at 4 a.m. this morning when I sent you the email that I sent you in the bed looking so crusty, I just pulled this together. So I always tell people, like, if you see me, like, you see me, but you ain't really see me. Like the balance of it all. I'm starting to become more comfortable with it, like being myself, being my true authentic self, still being a physician and balancing both. I will say my friends and my family, like my dad, he texts me every day. He can tell when something's off. He's like, how are you doing, baby? I'm like, okay. And he's like, okay, so what are you doing? Like, do I need to let's go to like let me send you somebody for like my family and friends know me to the T. I'll call my mom and I'll just be like, hey mom. She'd be like, what's wrong? So my family and friends, like my dad, my mom, my sisters, and then my all of my friends, just they keep me going and they kind of pull me out of those funks. Like I just went to the ballet Sunday, and that was me saying like, okay, I'm gonna go because it's hard to get me out the house. Like I between mental health, self care, like I'd be like, okay, let me do this. I will feel better if I do this, and I just go, and I'm like, okay, I feel better. So it really like it may look like everybody when they discover my social media because I be keeping it on a hush from like people at work. They're like, oh my gosh, you look like you have your life so put together. I'd be like. Little do you know, I didn't record all these videos in one day, and I'm dying with other 10 days. It really is like me getting older, it takes work and planning and like I really have to be intentional about doing my hair, going out and seeing friends, like putting energy to that. And that's where I'm at right now. And it's definitely imperfect still. But I'm really saying, okay, this I love hosting. Like I love getting dressed, looking cute. I love going to get drinks with friends, like stepping out on the ground, like, oh, we about to tear shit down. Like
Yeah.
I love that, but it's very hard. And I am starting to come to a place like I have to be intentional about this. I have to make sure I'm still doing that and still resting and having self care days. So it's not easy. All that to say, it's not easy being a baddie.
Yes.
Um, but it's a work in progress, and I'm
Yeah.
still trying. And I appreciate you seeing me because I'm trying, and it's hard.
And girl, you're doing for real because
Yeah.
I'm consistently like, I mean, my husband was like making fun of me because he saw me. I'm like, okay, let me put on a little makeup, right? Because if again, if you see me, you see me, and like I'm on Instagram where I post every now and then when I'm like, okay, I got it. But I think the being intentional, and one of the things that I said that I was going to carry over or sort of develop into the new year is just patience. I think
Mm,
I am so used to going from thing to thing to thing to thing to thing because I've had to for so long that it's like I feel like I'm always rushing through things. And so it's like if I just said to myself, you know what, girl, when you wake up in the morning and you go to the gym, come home, take the shower, put on some clothes and do your makeup if that's what you want to do. That's me saying to myself that nothing else that I have the rest of the day is going to take precedent over the next hour
fair.
that I'm sort of like saving for myself. So I
Yeah.
know that like you are probably at the max, but you are definitely being intentional about your space, which is appreciated. Have you ever felt like how do I, like you said, the balance? Like what is it that I want to show about
Yeah.
myself? And then is there ever a second guessing of like, oh, but that's a doctor.
Yeah. No, it is. And it's some things like before, like back when Twitter was Twitter and all that, and I'm just on there saying whatever, having a little kiki, and I'm like, okay, I can't post this. But then I realized like, okay, I'm still me and I'm still a doctor. And I think that like I've connected to so many black young girls who are like me, who like to get dressed, and they are seeing me be me, but they're also seeing me being a physician. And I was like, I have to be comfortable with me for real being a physician who I am. Like I know I'm starting like it's even in work too. In work with my coworkers, I have stopped. I never code switched, but now I show my personality a little bit more. And like in social media, initially I was like very tight, very constricted. Like I didn't show any personality. Now I'm like I'm me. Like it I've gotten so many opportunities, been able to connect with so many young girls, and then just brands like, "Oh, I love how you're authentically yourself and you're still a physician." Like I definitely still keep it cute and like close friends see way more, but just being able to show up as who I am, a young black girl in her 20s, like you said, that's still lit. I still like to go out, but I am still passionate about healthcare. I think it's so important to see that in social media because coming up, I still follow the same handful of black doctors that I followed, but now I'm seeing even more. Like it's a lot of us, even black professionals, PhDs like yourself, people who are professional, but it's not LinkedIn. Like they are really living their best life. And I'm like, okay, I owe it to myself, but then other people coming behind me to just be me. Like this is it's very real. Like I'm turning up in the car before work. I'm going into work, providing the best care I can, and then I'm going home and I'm chilling. Like it's okay to be normalized being a physician. And I it was a struggle initially. Then I was like, okay, fuck all that. I am who I am. So it was definitely a transition and a journey, but I am definitely noticing like I owe this to myself and others just to be me.
100%. And also recognizing that if I can't be me, you are not going to like me. And you are
Yeah.
not going to want me, like for me it's like you're not going to want me teaching your class if I can't be me, right? Because you're just not going to want that. You're not going to want me being your therapist if I can't be me. Because a big part of why I'm able to be successful is because I am who I am. And I
Yeah.
think for so long we've sort of boxed ourselves in these sort of positions, and I think and I will say some of the people that have come before us, maybe they didn't have the luxury, right? Or the environment wasn't as friendly and welcoming to that, and so they get stuck in sort of like these personas. But for us it's just like I'm gonna be me. A big part of it is like if I cannot be myself, then this is not going to work out. I'm going to be annoying. I'm going to be stuffy. Like my students to tell you, my clients to tell you. And sometimes I've run across people
Yeah.
where it didn't really work. It
Yeah.
didn't, right? So I've had patients or clients who sought me out to be their therapist and we're working together for a little while. And I can tell instantly, like, this probably is not going to be the best fit. But
Yeah.
simultaneously, there are most of the times where I am a good fit. I'm not going to be everybody's cup of tea, and I'm not going to stress myself out about it to be your cup of tea. I spent years, my entire life, getting to the point where I can access freedom in that way. And
Yeah.
I am starting to become a little more comfortable with it. Like, my mother's from the South, right? So, and from DC. And so her baseline growing up was a little like, make sure you're put together, make sure all of these things. But she had to do that in order to break through her barriers. But for me, it's like, I'm going to do some of those things, but I'm also going to be me. I love a good curse word. I don't care what
Yeah.
nobody says. Like, no, it's not a reflection of my vocabulary. Because if I wanted to read you with some words from the dictionary, I could, but I just rather not. Because
Yeah.
fuck sounds a lot better. And I don't know really what to tell you, right? And it just sort of brings out the passion that I need. And I just
Yeah.
refuse to be boxed in that way. And I love that you are doing the same, and it's showing up. And I think it's showing up very loudly in how you post, what you choose to post. And no one can question who you are because you've done the work at this point.
Yeah, and I think, like you said, remembering that you've done the work, so you show up at, like, and everything you just said. How am I going to show up as my best self if I can't even show up as myself? Like,
Mm-hmm.
I can't even. How am I going to do that? So, like you said, just being authentic to you. And I love that, and I love seeing Black individuals who are young, lit, like just living their best life, and then being professional too. Like, that's so tea for me. Like, I
Yeah.
love that. I
Same.
love it. It just gives like we are the new normal, kind of. I like every it's so amazing. Like, again, like going back to college, like seeing doctors and lawyers and nurses and everybody, like, I see you at that kickback, like, and now they're still lit, but they're professional. I just think
Yep.
that's so like empowering. It's so I love seeing that. That's my favorite thing. I love that song. That is my
Same, 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 same. So before we go, what is sort of next for you? The holiday season is approaching. How are you celebrating? Any new fun things that you are headed to?
Yeah, I am. So I will say I have been in a little holiday funk, but I did decide to put my tree up this week. I am going back on service, so I'll actually be working Christmas and New Year's, and
Okay.
I'll be working in the hospital, which is fine. But I think after that, in the spring, I have a little week vacation. I might do something like take a little trip or something, or I tell my friend, my one of my best friends, they live up here in they actually moved to Boston when I came to Boston,
I
and they
love
work
it.
pharma. And I'm like, okay, we're gonna get our life together this week. You know how you gotta, like, okay, I'm gonna sit down, write in my planner, we're
Yes.
gonna get a cute little drink, and we're gonna take over 2025. So I might just do that, but I love a good, like, how the kids say, a good yap session. Like, I love sitting down, just chatting. I think I might do that just to decompress
Yeah.
after the days and kind of just focus on putting my best foot forward, whatever that looks like, figuring out what trips I'm gonna go on. Like, I think that's what I need to sit down and plan and just decompress. So I'm looking forward to that.
I love it. I love it. What is on your list of travel? Like the next place you want to go to?
Yeah, well, I think not that if any of my family or friends see this, I think I'm going to Ibiza in May. One of my other best friends is like graduating with her master's, so I'm like, let's go celebrate in Ibiza. So I think we
I
might
love
do.
it.
So I think that's the next big trip. But otherwise, just because residency is real, saving, being on a budget, managing my time and my money, to save up for that trip. And then just finding like little things around the city. Even though I've been here for so long, I feel like I haven't like really explored because I've been working or in school. So just taking time to do that. How about you? Do you have anything good coming up with your husband or any family?
Yeah, so our anniversary, so Christmas is coming. My mother will be here Sunday, so I'm excited to sort of like hang out with her. My girl just she published her like self-published her book and had like a book signing last week. I was super proud of her. So she will be here. And then sort of we'll do the Christmas thing. My husband is a big Christmas person, like probably Mr. Christmas himself. So we always host on Christmas, and then our anniversary is actually New Year's Eve, and so
Oh,
I think this year
beautiful.
we're gonna chill it out. We haven't established any plans, although like My husband is tired of me shopping, so I feel like even if he did make a plan, he didn't want to tell me because he didn't want me going out and spending a whole bunch of money on trying to find a new outfit. So either we're going out and I'm gonna have to wear something I got in the house,
Uh-huh.
or we're gonna be in the house. But either way, so that's it. And then I think, for January, I'm just sort of like, again, just I want to just be able to practice patience and sort of
Yeah.
practice this idea of slowing down and not being all over the place and taking more time to just be intentional. I was telling my therapist, like, girl, I just want to put some lotion on. Like,
I'm not. It's crazy. I can't wait till she see this. One of my best friends be like, "You are so ashy." And I'm like, "Baby, sometimes I don't got the strength to put on lotion." And I know that sounds so simple, but I am. When life gets me down, I'm gonna just be ashy. So like, no, like you. That's so crazy. Self care, because that's one thing about me. My feet not gonna have on lotion. Cause that's just you not going. But I do want to improve on that. That is
same,
so.
same. Like, no, I be ashy for sure. But like you said, it's just because I'm like, all right, I'm going from the next thing to the next thing, and putting on lotion the right way. I gotta have the lotion. I gotta have the oil to mix with the lotion. Like, this is a whole 2-3 minute process. And
It
granted, that
is.
doesn't sound like a lot, but it is. And I just be
It is.
moving through. And my husband sometimes be like, girl, like what? I mean, you cracking at the seams. So it's just like, I just want to put on lotion. I want to take my time. I want to
Yes.
just do things a little different and be more intentional. I'm really loving the podcast space. And so just trying to like be consistent there. So I'm going to be
Yeah.
chilling. I'm going to be chilling.
I love the podcast and I love what you said. Like you said, I think that the just chilla is my thing. I will say this is my last year of my 20s, and I have such a good group of girlfriends. And like I have my best friend's a doctor, she's in Florida, and I have so many I have another best friend that's like in Philly, and I need to go see him. But just pouring into myself and my relationships, like that's such a big thing for me this year. And
Mm-hmm.
simple things like taking time to put on lotion. Like sometimes I'd be like, fuck, I don't want to go get my bonnet, and I'll go to sleep. Like just little self-care things. Like I just being still and being patient with myself, and I love all that. That's my 2025. We're gonna have to check back in and see if we're doing that. But
No, seriously. I should be saying to you like, hey girl, just making sure you put some lotion on today and put that hair in a bonnet. But no, you are absolutely right, and it's the time taken. And so I am so glad to have had you. I really appreciate our content and our discussion. I'm sure I will have you back at some point.
I would,
But yes,
yeah.
I really do appreciate it. But I will let you go for today. And we will sort of catch back up at some point.
Absolutely. Happy holidays to you and yours. Thank you again for having me.
Same, you too, you too.